Good morning and welcome to this morning's webinar. My name is Daryl Moon and I'm excited to be with you today. This is the 10th webinar in our series of short 30-minute webinars on the best practices of managing population mental health, brought to you by Going on Offense and sponsored by Resilience Pro. Recordings of each of the previous webinars can be found on goingonoffense.com. The pandemic has certainly heightened the need to address mental health. The uncertainty that we all face is having a devastating effect on many people's emotional well-being. I've had the privilege of being a part of an innovative team that's been managing population mental health now for over 20 years. Just a little bit about my background. My first career was running hospitals. Had the opportunity to run 10 different hospitals across the country, from Utah to California to Texas to South Carolina to Illinois. 8 of those 10 hospitals were psychiatric hospitals. So most of my time was spent working as an administrator or assistant administrator or chief financial officer of hospitals, and specifically psychiatric hospitals. Well, about 23 years ago, I had the opportunity to join a very creative team back here in Utah, which is where I'm from, to approach mental health from a very different perspective. Instead of the typical managed mental health where you raise the rates every year in order to keep up with the cost and make a profit, this concept was more of a true ACO type principle where profits came from not spending money versus increasing rates. So it's a very abundant strategy where our goal was to prove that if you really reach out to people early, address from a preventative or an early intervention standpoint, and then you became very abundant in getting people in quickly and early and making sure people didn't fall through the cracks, you could actually spend less money in providing mental health services, and the profits would come from keeping people healthy versus spending money treating them. I felt like as a hospital administrator, I sat at the top of the food chain of healthcare and really was at the bottom of a cliff waiting for people to fall off so that my hospital could be full and we could make lots of money. Well, it's been truly a pleasure to be a part of a system where profits came from keeping people on the cliff, putting up fences, and getting people the help they need early versus parking an ambulance at the bottom of the cliff and capturing the most people that fell off. Anyway, as we've been managing this over the last 20 years, we felt like when the pandemic hit that it would be a good idea to share some of the best practices that we've learned by managing population mental health. And that's what this series of webinars is about. Each week we're taking a different principle or concept that we've learned and sharing it, and then recording it and putting it on the website for everyone to hear. So far, we've addressed a number of topics. For example, the need to integrate mental and physical health, overcoming the stigma barrier. We all know that mental health stigma is probably one of the biggest reasons for people not getting help or waiting too long. In fact, statistics show that people wait on average 10 years after mental health symptoms appear before they reach out for help. That's too long. And almost 60% never reach out for help. Hence, they wind up having other things that occur or things become serious and critical. And we wind up spending a lot of money and they wind up having a lot of pain because we're not addressing things early. So we address the need to overcome the stigma barrier. Technology that monitors the emotional well-being of populations so that you can provide a true preventive maintenance program to implement and maintain optimal mental health. How to attract and retain top talent through supporting emotional well-being, filling the holes left by many EAPs, proactive emotional health and measurement-based care, the role of technology and mental health apps, ensuring prompt access to the right mental health provider. Last week, we focused on mental health best practices for youth. Today, our topic is managing serious or severe persistent mental illness. Please send in your questions as we go through the webinar today. We'll be happy to address those after the short presentation I'm going to do. And so you'll know this presentation is available to you to download through your control box during the webinar, as well as a handout or a brochure from Resilience Pro, which is the sponsor of these webinars. So let me start the presentation and we'll talk a little bit about best practices for managing persistent and serious mental illness. So first of all, let's kind of define what that means. So some examples of serious persistent mental illness are major depression, bipolar disorder, schizophrenia, schizoaffective disorder, obsessive compulsive disorder, and eating disorders, to name a few. Clearly, serious and persistent mental illness has a profound effect on family relations, educational attainment, occupational productivity, and the social role functioning within a person's life, being able to function within society. The economic impact on the United States is tremendous. It's a very small percentage of the population, only 2.8%, but that represents 5 million people and $148 billion per year, which is about 10% of healthcare costs. Now, this was a few years ago. Healthcare costs more than that, so the number is probably much more significant than that. But clearly, a huge impact economically on the U.S. So let's talk about the best practices that we've learned by offering a very abundant strategy in managing mental health. And of course, there's always going to be a few of these. The whole goal, though, is to get involved early and address problems before they become significant. But you're always going to have a few people that represent a lot of cost and a lot of turmoil if you don't manage them well. And of course, by managing them well, what I really mean is helping them to manage their conditions as best possible. First of all, medical homes need to integrate medical or mental and physical health and treatment. Number two, an all-inclusive team. Number three, individualized treatment. Four, managing the social determinants of health. And five, enhancing self-efficacy. So let's go through each one of these. Number one, a patient-centered medical home. Truly, we've discovered that a team-based approach where the definition is a team-based healthcare delivery model to provide comprehensive and continuous medical and mental health care to patients with a goal to obtain maximal health outcomes. The integration of medical and mental health is critical, especially when dealing with severe mental health patients. It truly has been shown to increase mental health recovery. We too often in this country put medical and mental health in two different silos, and there's a need to integrate those across the board, but nowhere does that need exist greater than in managing severely persistent mental illness patients. Number two, it's important to have an all-inclusive team. So what that means is, number one and most important, the patient. The patient needs to be a part of the team as well as the treatment plan development. They're in the best position to contribute as to what's going to help them long term. Number two, the family members are an incredible part of the team that need to be a part of the treatment plan. Social support system, friends, family, those around the patient that play an incredibly important role at supporting the patient. The psychiatrist, the primary care physician, any specialists that might be involved. Often these patients have significant comorbid conditions that are on the medical side. And so again, it's necessary to manage the entire health of the patient rather than in silos. The therapists, and there might be multiple therapists, the social workers, and even the health coaches. All of those and more are important. And what we found is probably one of the most important things we've done is when there's a difficult, high-risk patient, you bring the team together on a regular basis, and you really because the treatment the team is going to need to change, and the plan is going to need to change. And having those members all on the same page is an incredibly important strategy in managing these difficult and expensive patients. The treatment plan needs to be very individualized. Often these severe persistent mental illness patients require a creative out-of-the-box treatment approach. It's not always a cookie cutter, well, this is the condition, so let's apply this treatment. We found that some very creative plans have been developed with the patient involved that perhaps wouldn't have been a typical approach, but have been very effective. Again, thinking outside the box is very important. No two patients are alike. It needs to be a very individualized treatment plan, and it needs to adapt to constantly changing factors. There's no question that life doesn't stay static, and neither does the plan. It needs to be consistently changing to apply or to be appropriate for the factors around the person. And it needs to be far more than simply medication management. And many times these patients are on a medication. And clearly the psychiatrist is involved, or the primary care physician involved in the medication they may be taking for their chronic conditions, but it's a treatment plan that's far more comprehensive than just what's the medication the patient is on and whether they're taking it. Number 4, manage the social determinants of health. Can't underline how important it is to look at the entire environment that the patient lives in. Let's go through a few of those. So what are social determinants of health? Well, the availability of resources to meet the daily needs, education, job opportunities, wages, the ability to earn an income, healthful foods. You know, it's interesting, there are many places where you can't get healthy foods. About the best thing you can do is get a fast food breakfast or run to the local gas station and pick up something that's not very healthy. And too often patients are trying to live off very unhealthy food. And the nutrition part of health and well-being is incredibly important. Social norms and attitudes play a big part. Exposure to crime, violence, and social disorder, socioeconomic conditions, quality of schools, transportation options, public safety, and residential segregation, all of which are determinants of health that need to be taken into consideration when helping a patient with a severe mental illness try to manage within their environment. Let's talk number 5, enhance self-efficacy. Now, this doesn't apply in every single case, but many times persistently mentally ill patients struggle with self-efficacy because of the challenges that they face. Bandura said it well, self-efficacy has a central role in regulating and the regulation of emotional states. Often patients find themselves in a very victim state of mind, which is devastating. What we've discovered is that frequent contact with an accountability partner, for example, a health coach, someone that's not very expensive but can have very ongoing frequent contact with the patient, showing compassion and empathy can have a significant impact on increasing self-efficacy. And the focus and the strategy that works the best is to not define for the patient how they want to help, but rather have the patient define for themselves what struggles they're experiencing. We all struggle, and certainly patients with severe mental illness struggle mightily. And where you can have the greatest impact on enhancing their self-efficacy is to identify for them or by them, for them to identify what are they struggling with? What is it that they seem to be most frustrated with themselves about? And if you take that and you break it down and you help that patient make small incremental progress, literally tiny steps in a direction towards overcoming those battles and making those improvements, building that self-efficacy and helping that patient to build a greater self-esteem has an incredibly important role at the overall emotional state of anyone, but particularly these persistently mentally ill patients. All right, so to recap, the 5 best practices that we're sharing today that we've discovered after managing population mental health for over 20 years is the need to integrate mental and physical treatment. Call that a medical home. And it's been proven many times that the medical home environment is an incredibly effective way in managing chronically ill patients of any kind, but particularly those with severe mental illness. An all-inclusive team, individualized treatment, and making that treatment plan adapt to ever-changing factors that occur. Managing the social determinants of health for that patient. And 5, enhancing self-efficacy. So would love to have questions now come in from you. You're welcome to use the control box and we'll address your questions and try to expand on this even more. Okay, you talked about frequent contact from an accountability partner. How frequent? We found that 2 to 3 times a week is not too frequent when working with the patient who's struggling with a victim state of mind and helping them to overcome things that they're battling with inside. So a very frequent contact, and sometimes that can last a year or 2 or even 3 years. So it's not a short-term little quick thing. It's something that often happens over a long period of time. Thank you for your questions. So do these severe or seriously persistent mentally ill patients ever get better? Many times it's not, they don't. Sometimes it's a lifelong chronic condition, but it can be improved. And so obviously what we're trying to do is help them manage their condition over the long haul in a more effective way, where they're, the variations that occur during life can be evened out and smoothed out. In a medical home, who takes the primary lead? Is it the primary care physician or the psychiatrist? Well, it really depends on the patient. Many times it's one or the other. It's not always the same. If the most persistent condition that's affecting their health is their mental health condition, often it's the psychiatrist that takes the role on the team. If, on the other hand, there's some serious chronic conditions, medical conditions, sometimes it's the primary care physician that takes that lead. When is the onset of most of these severe persistent mental illnesses? Actually, we find that adolescence and young adults is generally when a chronic condition that we talked about is brought up, or where we see these happen most. So it's an important period of time for someone, and it's important to address those concerns early. Please send if you've got other questions. We'll be happy to address those. While I'm waiting to see if anybody else has any questions, let me just address that Resilience Pro, the sponsor of these webinars, is an integration of all of these best practices. It's really taking the best practices that we've discovered after managing mental health through a very abundant and cost-controlled environment, taking those strategies out to anyone across the country, any organization. So take a look at Resilience Pro, download the brochure. We'd be happy to discuss with you further, but Resilience Pro is really a combination of addressing all of these best practices for employers or organizations across the country. All right, not seeing any more questions. Let me just simply mention that, again, there's a brochure describing Resilience Pro, which is the sponsor, that you can download from your control box. You're also welcome to download today's. Looks like a question just came in, so let me stop and answer the question. How can employers reduce the stigma of mental health issues in the workplace? Love that question. There's no question that culture and awareness campaigns can be some of the best ways to address the stigma associated with mental health. For example, if an executive or a leader of a company is a little bit vulnerable and willing to share through an email across the board to all of their employees their own struggles, and right now we're all struggling with the pandemic, there's nothing that kind of frees up people to feel like they can address and approach and really address their mental health problems than to know that it's safe within the organization to do that. So clearly employers can reduce the stigma by just creating a culture where it's okay to get help, as well as making sure that people are aware and know that there are resources available. For example, many employers have an employee assistance program, but many employees don't know how to use it and don't know that it's available. So not only promoting the EAP to your workforce so that the people can get access to early intervention, but also training managers on how to have critical conversations. They're often the ones who see problems beginning to arise within their workforce, within their departments, and training them how to have critical conversations on how to address and how to help people not become involved in their personal problems, but how to get them over that stigma barrier to get help from the EAP. Again, the manager doesn't need to know, the company never knows what's going on at the EAP, but the manager can play a very important role at encouraging people to get help when help is needed. Great question, thanks. All right, not seeing any more questions. Let me go ahead and wrap up today's presentation. Again, you can download the brochure about Resilience Pro from your control box. Next week's webinar in this series of best practices of managing population mental health will be on managing to the patient's needs, not their benefit. Too often in healthcare, especially in mental health, treatment plans are designed around what does the benefit allow? And we've learned that that's not the way to manage a patient's care. It's about managing to the needs of the patient rather than the benefit. We'll talk more about how we do that. All right, We would welcome you back to a future webinar. We hold these every Wednesday at 9 o'clock at Mountain Time, and we wish you a very good day. Thanks.